using Manage My Health, you've probably seen the headlines and wondered, was my information accessed? What should I do now? And how is my GP finding out about this? My name is Dr. Jo Tooby. I'm a working GP in New Zealand. And in this video, I'll answer the main questions my patients will be asking. And I'll be clear about what Manage My Health says, what health authorities say, and what I can tell you from inside general practice. Manage My Health has reported that unauthorised access to part of their system occurred in late December 2025, with the issue identified and acted on around the 30th of December. The questions I'll be answering in this video are: was my medical information accessed? What type of information could have been seen? Does this affect my GP clinic systems or Health New Zealand, as in hospital records? Should I stop using Manage My Health? What should I be watching out for now? Is there evidence my information has been misused? And what does this look like from a GP practice point of view? Was my medical information accessed, you might ask? Well, according to Manage My Health, unauthorised access occurred to part of their platform, not every account and not the entire system. What Manage My Health have said is, not all users were affected. The issue was limited to a specific section of the Manage My Health portal, and they have said that forensic investigations are ongoing. Manage My Health has also said that patients whose information is confirmed to have been accessed will be contacted directly by them. You might also be asking what type of information could have been seen. Manage My Health has said the access involved the health documents section of the portal. Depending on the patient, that section may include test results, specialist letters, uploaded medical correspondence. Obviously, any amount of health information is sensitive, and that's important to acknowledge. I have no reason to believe that full GP clinical records were accessed, so that is good. From a GP perspective, that distinction certainly matters, but it doesn't minimise the seriousness of a privacy breach. Does this affect your GP clinic systems or the hospital system at Health New Zealand? Well, according to Health New Zealand and the Health Minister, there is no evidence that this breach has affected either GP practice management systems, that's to say the practice software that we use to manage patient clinical records. So according to Health New Zealand and the Health Minister, there is no evidence that this breach has affected either GP practice management systems, Health New Zealand infrastructure, so that is the hospital system, or systems used to deliver care. So that's excellent news. This means that it's very much a privacy and data security issue and not a clinical issue, so no disruption to patient care is expected, which is good news, although obviously a privacy and data security issue is still very important. So should you stop using Manage My Health? At this stage, Manage My Health has not advised users to stop using the platform, of course. They've said the vulnerability has been identified and fixed, and that independent security experts have reviewed the fix. Manage My Health recommends that users change their password, preferably to a strong and unique password, and also enable two-factor authentication if available. So from my GP's perspective, I mean, you can always argue that these points, sometimes come a little bit late, but it is good to know that increased security, if you haven't already got a good password and two-factor authentication in place, do look into that via the Manage My Health portal and see if you can activate those extra security layers for yourself. Certainly from a GP perspective, those would be sensible steps to take. So what should I be watching out for now? Well, Manage My Health and the Office of the Privacy Commissioner advise that patients should be alert for suspicious-looking emails or texts claiming to be from health services, requests for personal or medical information, messages that don't match how your clinic or health service usually communicate. So the official advice is to avoid clicking on links that you're unsure about and to contact the health service that you believe those messages may have originated from. Or you can contact Manage My Health directly if you're concerned. So is there any evidence my information has been misused? Well, as of now, Manage My Health and authorities say there is no confirmed evidence of patient harm or misuse. That position may change as forensic investigations continue, which is why Manage My Health say updates are ongoing. And lastly, what does this look like from a GP practice point of view? Well, speaking from my own perspective as a GP and as a practice owner, I can say that we have not been told whether any of our patients' information was affected. We don't have a list of patients who are affected, so we cannot contact them directly. So information from Manage My Health to at least my practice, as far as I know, has been not forthcoming, sadly. So it makes it very challenging for GP practices because patients understandably come to us first, and at the moment we don't have any more detailed information than what's available publicly. So that's very frustrating. We feel frustrated for our patients, and considering that Manage My Health is the patient portal for at least half the general practices in New Zealand, you can understand that there would be a very high level of frustration amongst patients and doctors alike. So to summarise what we know right now, Manage My Health says the issue has been fixed. Health authorities say that there's no impact on patient care, and certainly from a GP practice point of view, it does not look like we'll have any issues delivering patient care, so that's fantastic. GP practices are still waiting for more specific communication from Manage My Health. If your information was accessed, you should have been contacted directly by Manage My Health at this point in time, and I'm recording this on Sunday the 4th of January 2026. So if you haven't been contacted by now, you could be quite right to assume that your data was not accessed. But I don't know how quickly Manage My Health are able to inform people. This is part of the problem, and as I've mentioned, GP practices are not any wiser, sadly. So that concludes my video about the Manage My Health data breach in New Zealand. I really appreciate you watching this far. If you would like further clear, calm explanations of what's happening in New Zealand healthcare, including what it looks like on the ground from a GP perspective, please subscribe and let me know what you'd like me to explain next. Do leave a comment or any questions down below, and I'm more than happy to cover any topics that you might think to ask any questions about. So do be in contact, let me know what you think, and see you in the next one. Thanks for watching.